Welcome to Think Tank Healthcare. According to the National Institute on Drug Abuse, NIDA, substance abuse is a serious problem among youths, with 1 in 4 high school students reporting the use of drugs or alcohol in the past month. Substance abuse can have severe consequences, including addiction, overdose, and long-term health problems. In this video, we will discuss the consequences of youth substance abuse and ways to prevent and treat it. Consequences of youth substance abuse. Youth substance abuse can have serious short and long-term consequences. In the short term, it can affect a youth's academic performance, mental health, and social relationships. Substance abuse can also lead to dangerous and risky behaviors such as driving under the influence, unprotected sex, and violence. These behaviors can result in accidents, injuries, and legal problems. How to know if your kid is a victim of drug abuse. There are many symptoms of drug abuse, but some of the most common signs your teen is abusing drugs are: problems with the law, such as DUI, breaking curfew, stealing. Problems at school, such as excessive tardiness, poor grades, suspension. Mood swings. Loss of interest in favorite activities. Drug paraphernalia. Violent behavior. Withdrawal. Depression. Poor hygiene. Missing money. Drug abuse at any age can cause serious health effects, but teens who abuse drugs are at particular risk for negative consequences. Teens who abuse drugs are more likely to struggle with addiction later in life and have permanent and irreversible brain damage. Some other common negative effects of teen drug abuse are: emotional problems. Drug abuse can cause or mask emotional problems such as anxiety, depression, mood swings, suicidal thoughts, and schizophrenia. In fact, among teens with major depression, 34.6% report using drugs. Unfortunately, drug use can also increase the severity of these emotional problems. For example, teens that use marijuana weekly double their risk of depression and anxiety. Behavioral problems. Teens who abuse drugs have an increased risk of social problems, depression, suicidal thoughts, and violence. According to a recent survey by the Substance Abuse and Mental Health Services Administration, teens who abuse drugs are more likely than teens who don't abuse drugs to engage in delinquent behaviors such as fighting and stealing. Addiction and dependence. Studies prove that the younger a person is when they begin using drugs, the more likely they are to develop a substance abuse problem and relapse later in life. Risky sex. Teens that use drugs are 5 times more likely to have sex than teens who don't use drugs. Teens that use drugs are also more likely to have unprotected sex and have sex with a stranger. This leads to higher risks of STDs, teen pregnancy, and sexual assault. Learning problems. Drug abuse damages short-term and long-term memory and can lead to problems with learning and memory later in life. Diseases. Teens who abuse drugs with needles increase their risk of blood-borne diseases like HIV, AIDS, and hepatitis B and C. Brain damage. Drug abuse among teens can result in serious mental disorders or permanent, irreversible damage to the brain or nervous system. Brain damage among teens who abuse drugs includes brain shrinkage, impaired learning abilities, amnesia and memory problems, impaired reasoning, perception and intuition, increased or decreased socialization, and changes in sexual desire. Car accidents. Teenagers who abuse drugs are more likely to be involved in car accident-related injuries or death. One study showed that 4 to 14% of drivers who are injured or die in traffic accidents test positive for THC. In the long term, substance abuse can lead to addiction, which is a chronic brain disease that can affect a youth's physical and mental health, relationships, and future opportunities. Addiction can also lead to overdose, which is a life-threatening medical emergency that can result in permanent damage or death. Prevention and treatment of youth substance abuse. Prevention is key to reducing youth substance abuse. Parents, schools, and communities can play a crucial role in preventing substance abuse by providing education, support, and resources. Parents can talk to their children about the risks of substance abuse and monitor their behavior. Schools can provide drug and alcohol education programs and support services for students who are struggling with substance abuse. Communities can provide safe and supportive environments for youth and promote healthy activities. Treatment is also essential for youth who are struggling with substance abuse. Treatment can include behavioral therapies, medication-assisted treatment, and support groups. Behavioral therapies, such as cognitive behavioral therapy, can help youth change their attitudes and behaviors related to substance abuse. Medication-assisted treatment can help reduce withdrawal symptoms and cravings. Support groups, such as Alcoholics Anonymous and Narcotics Anonymous, can provide peer support and encouragement. Youth substance abuse can have severe consequences, but it is preventable and treatable. By providing education, support, and resources, we can help save our youth from substance abuse. If you or someone you know is struggling with substance abuse, seek help immediately. There is hope for recovery, and a brighter future is possible. Thanks for watching the video. Feel free to comment your thoughts on this topic. Please do subscribe for more mental and physical health related videos.